Joining us now, Elaine Parker. She is the president of the Job Creators Foundation, part of the Job Creators Network. I wanted to get her on today because I'm going through. We've talked about their cool health plan that they put out, and I was asking, I'm like, well, are you going to turn this into legislation? I mean, how are you going to make this? How are you going to make this into something, et cetera? And then the other day, I'm like on a phone call with the White House, and they said, we have this new healthcare plan. It's called Healthcare for You. And I'm like, what? That's Job Creators Network plan, the Job Creators Foundation, that Elaine Parker is the one that drove it. And I'm like, wow, they've adopted her plan, Elaine. So I had to get you on today to talk about it.
Hey, John. Good morning. How are you doing?
Fired up.
We are too. We're very excited that the White House likes what they're hearing in the Healthcare for You plan. And they're certainly talking in terms of the same type of framework that we've laid out, which includes repairing, restoring, and improving that doctor-patient relationship by increasing choices, increasing competition, which will decrease price, and having more price cost transparency, because we know that in every industry where we have price transparency and competition, that the costs come down, and the healthcare industry is no exception to this economic fact.
Well, I mean, look, it's a great plan, but I was asking you for a month, how do we turn this into legislation? We can talk about it on the radio, we can talk about it in think tanks, but how does it become real? You guys went right to the top. I mean, you went to the White House policy team and you got them to adopt your principles that you've worked so hard on, bottom up, by interviewing so many people. And now they're even calling it by your name, which is Healthcare for You. How did you do that in like 2 weeks?
Well, look, I mean, the plan makes sense. And the reality is what we did was we partnered with a physicians organization called Physicians for Reform. And we went out there and we did some very sophisticated market research, which involved getting the inputs of 25,000 American voters. These weren't just Republican voters. These were Republicans, independents, and Democrats. And we asked them what they want in a healthcare plan. And what they want is they want to reduce the complexity of the system so that they can repair this patient-doctor relationship, so that they can be in charge of their own healthcare dollars and decisions. Because, the reality is the more complexity you have in a system, the more it separates doctors from patients. And that's the system we have under Obamacare now. Obamacare came into a broken system. We had things that needed to be fixed in the system, but it made a broken system even more broken. And so what we've laid out in our framework for healthcare reform on our website, healthcareforyou.com, are 7 elements that can repair, restore, and improve this patient-doctor relationship by increasing choice, increasing competition, bringing down the cost of prescription costs, protecting pre-existing conditions, all of the things that the American people want. And what, we just had Elizabeth Warren's plan come out. It's $57 trillion, John. I mean, you think it was monopoly money that we're talking about. $57 trillion for a Medicare for All plan. And, the solution is more government. Well, we need only to look at Obamacare, which was more government, and see that premiums have increased almost 200%. Choices have decreased. Quality has gone down. Access has gone down. Yes, people have insurance cards in their wallets now, but it doesn't equate to access and it doesn't equate to care.
So the Warren plan that came out, which basically rivals your plan, yesterday they asked her because one of the things they asked her is it going to cost jobs, right? Because if you take over the health industry, you got all these people that are going to be out of a job. So it's millions of jobs. And although she's not answered how much taxes are going to go up, she answered that and she says, well, yes, many people are going to lose their jobs, but that's part of the reformation of health, and eventually they'll get other jobs. I mean, it's like, you got to be kidding me. So millions and millions of people are going to lose their job. And as far as Warren's concerned, too bad, you get another job. She said it's just part of what you have to do in order to change and reform care. People are going to have to get different jobs. It was almost like, well, you were a blacksmith. Now we've got automated vehicles, so you'll have to get out of the blacksmith business. I mean, it's insane.
Absolutely. I mean, like I said, $57 trillion. I mean, we just can't even compute what that looks like. No one believes what's coming out of Elizabeth Warren's mouth except Elizabeth Warren. No one believes that the middle-class taxpayers are not going to see an increase, a tremendous increase in taxes. I mean, we essentially have to double, at a minimum, double our taxes to pay for a system like this. It is absolutely impossible. And just to side note this, my nephew was recently in the hospital for a medical issue, and my sister obviously follows the healthcare issues very closely. She's worked in the healthcare field, as a matter of fact. And she was talking to the nursing staff at the hospital about Medicare for All. And she said every single one of the nurses said to me, as they were taking care of my nephew, that if they had a Medicare for All system, it would be a travesty. That's the word that they use. These are the people on the front lines, John. We need to listen to the people on the front lines this time, because we didn't listen to them last time. Their voices didn't get heard. And John, if you remember, Job Creators Network was really on the front lines of the Tax Cuts and Jobs Act fight. And what voice did we put out there? We put out small business owners. We made sure that America heard small business owners and why they needed a tax cut. Now we need to combine the small business owner voice with the physician community and have those voices heard, because small businesses have been killed by Obamacare. More than 30% of small business owners have had to drop insurance coverage for their employees because of the rising cost of premiums, because of the lack of choice. And it hasn't equated to more care, more access to more care. And physicians are being forced to close their practices because of the excessive red tape and burdens. And they actually are, 53% of them have gone to work for hospitals. And so they end up beholden to their employer, not to the patients. They have to be beholden to their employer because that's where their paycheck is coming from. And it's continued to put more distance between doctors and patients. And those are the two people in the relationship that should be making the healthcare decisions, not bureaucrats, not insurance companies, and not politicians.
You're on the John Fredericks Radio Network, trucking the truth across America. We're in Washington, D.C., your nation's capital, in Steve Bannon's bunker, our studio that we built in his basement. War Room Impeachment, episode 13, coming up today on the John Fredericks Network, 9 o'clock. We're with Elaine Parker. Elaine is the president of the Job Creators Network Foundation, and they developed Healthcare for You. Go to healthcareforyou.com, healthcareforyou.com. There's a bottom-up plan because Republicans had no plan to solve our healthcare crisis. So Job Creators Network Foundation took it upon themselves to do it themselves. Elaine Parker led the effort, and now, virtually a couple weeks, 3 weeks after their launch, it's been adopted by the policy team at the White House in the Trump administration, using that as their framework to go forward. So my question is, what happens now? Does the policy team in the West Wing, do they get somebody in the House to sponsor legislation and draw this up? What's the next steps, Elaine, to turn your great plan into some form of reality?
Well, I mean, look, John, we obviously are not going to see legislation in the House because it is democratically led. But what we'd like to see is the Republican-led Senate bring legislation forward so that the American people can see a clear legislative plan based on this framework, which will completely reform our healthcare system and put patients back in charge. And bring forward a plan so that the American people can have a clear distinction between Medicare for All, which is a top-down government approach with no decisions and no choice, or a healthcare for you, which increases choice, competition, and puts patients back in charge. It's personalized healthcare, and that's what the American people have told us they want in this sophisticated market research that we've conducted with 25,000 Americans.
So basically what the strategy is, you got the White House to adopt the framework of it because they were probably excited they finally had a plan that made sense, which you guys did. And it makes sense because you did it from the bottom up, right? All the research you did, all the interviews, average people, bottom-up plans, what people want instead of top-down, which was Obamacare and whatever else, Ryan's plan or whatever crap that was. They had no plan. So you got the White House to adopt it. Now you want it to go forward in the Republican-controlled Senate so that they can have a platform to show, even though it's not going to pass the House, they have a platform to be able to show America what this plan would be, and maybe it becomes what some House Republicans run on in 2020. Is that the vision? Have I properly outlined it?
Yes. I mean, if Washington, D.C. hears the American people about what they want in a personalized healthcare for you plan, Washington's going to listen. Whether they're Democrat or Republican, they're going to listen. They listened on tax cuts. They're going to listen on health care as well. You know, the White House likes what they're hearing. And the American people like what they're hearing. We just need to get the American people talking to Washington in a very loud voice, and Job Creators Network is going to act as a megaphone to Washington, D.C., so that they can hear loud and clear, it's health care for you. Healthcare for you.
And go to healthcareforyou.com. That's healthcareforyou.com. Elaine, you guys, once again, I got to tell you, the Job Creators Network, with very limited resources, it's like the little engine that would. What you guys are able to do is incredible. I mean, you totally were the number one organization behind the Trump tax cuts. Without Job Creators Network, I don't think they pass. You went all over the United States. You had 2 buses going on. You came on my show relentlessly. You got that passed. Then you realized there was no plan, no health plan alternative to a government takeover of health like Medicare for All. You spent the time and the effort and the money to build your own from the bottom up. Now it's been adopted by the White House, and it's going to end up being a campaign theme for House Republicans in 2020. I mean, think about what you guys have done here with this in, 2 months? Incredible.
It is incredible, and it's happening faster than I could have imagined, certainly faster than the Tax Cuts and Jobs Act happened. But it's because it makes sense, and it's because we know it's what the American people want. Whether, like I said, whether they're Republicans, Democrats, or independents, they want choice. They want personalized health care, and they want to be in control of their own health care decisions and dollars.
Mm-hmm. Well, I tell you what, the John Fredericks Radio Network, we are very proud and honored to be a part of being able to help you get this message out, and I want to thank you for that opportunity. It's really exciting. And, of course, I spent a long time blasting Republicans for repeal and replace because they had nothing to replace it with, and they basically lied for years. They had nothing, and we found that out, and the president ended up between a rock and a hard place with it. Now you guys have given them something, and I commend your work for that. Thank you.
Thanks, John. Thanks for having me on.
Go to healthcareforyou.com. The president loves this plan. Go to healthcareforyou.com. Elaine Parker, thanks for being with us.